And last week, the feds charged nearly 60 doctors and other medical workers across multiple states for overprescribing and handing out addictive painkillers. In some cases, allegedly trading pills for sex. But there is concern that these crackdowns are having an unintended consequence on patients who are really hurting. They're dealing with chronic pain. They've been wrongfully cut off from the meds that they badly need. So there's the rub. Jillian Turner reporting. She's live in Washington. Jillian?
Good afternoon, Shep. As the Trump administration ratchets up its campaign to curb the deadly opioid epidemic tearing through the country, new evidence is emerging now that government measures to stem the crisis are causing severe unintended consequences for some of the roughly 50 million Americans diagnosed as chronic pain sufferers. Hundreds of doctors, hospitals, and patients are now reporting being refused opioids they've been relying on and using responsibly for years. A new report from the New England Journal of Medicine is ringing alarm bells about doctors abandoning their charges, writing, rather than caring for patients receiving high dosages and supporting patients in efforts to taper their dosage, some clinicians may find it easier to refer or dismiss patients from care. Clinicians might universally stop prescribing opioids, even in situations which the benefits might outweigh their risks. The American Academy of Pain Medicine blames new CDC regulations they say adopt a one-size-fits-all approach to opioid use. They say it's causing a critical failure to appreciate the importance of patient involvement in decisions to taper or discontinue opioids. Health groups say patients suffering from cancer pain, acute sickle cell crises, and recovering from major surgery are being left to suffer pain untreated.
We and other groups have heard from thousands of chronic pain patients who have been forcibly tapered off their medications or dropped from care completely by their doctors. This is inhumane and morally reprehensible.
The FDA commissioner said last year that despite the nationwide opioid crisis, the reality remains for some patients, opioids are the only drugs that can treat severe pain, Shep.
Jillian Turner in Washington, thanks. Quarantine in California.